Good morning, students. Welcome to your VR experience for your reproductive health course. So I want to give you a few tips and tricks as you're doing your VR experience. You can interact in anything outlined in blue when you get into the scenario. All your equipment and bedside tests will be located on the bedside table, including your thermometer, your lab test, your IV start kit. As you interact in the scenario, you will click on your things outlined in blue and drop-down boxes will appear, and you can choose from them to make your decisions. When you go to take your respiratory rate, you need to click on the patient and click on the assessment tab for respiratory, and then count your respiratory rate. Once you collect all your vital signs, you'll click on the computer in order to document your vital signs. And you have to document all of them in a range and then hit enter, and they'll be documented in the computer. Make sure that at some point during your scenario, you call the doctor for an SBAR. When you start out, you'll be going into George Hamilton, which is an orientation scenario for VR. And after that, you'll go into Patricia Jackson, who is your patient who has chorioamnionitis. You can interact with a physician, your assistant, and her significant other throughout the scenario. One thing to notice with George, there is a clock in the scenario. With Patricia, there is not. The scenario generally lasts about 25 minutes. And once you're at that 25-minute mark, the scenario will just cut off. Once you are done the scenario, you can turn around, and behind you is the door, and there'll be a blue circle, and you click on that, and that will help you leave the scenario.
Welcome to our guide on getting the best experience with your Oculus Quest 2 headset. Whether you're just getting started or don't know what to expect, we've got you covered. Let's start with wearing your headset with glasses. First, place your glasses inside the headset, making sure they're comfortably aligned. Then, gently put the headset on, sliding it over your glasses. This method reduces any chance of scratching and helps keep both your glasses and headset secure. Now, let's talk about adjusting the lenses. The Oculus Quest 2 has 3 settings to help you find the most comfortable view. You can change the lens distance by gently moving them closer together or farther apart. Take your time with this step. Everyone's eyes are different, so finding the right setting makes a huge difference in your VR experience. Hairstyles and accessories can make a big difference when it comes to headset comfort. If you're wearing a hair clip, headband, or certain hairstyles, these can affect the way the headset fits. To ensure the best experience, consider removing any accessories that might press against the headset. Now let's adjust the head strap. For the original head strap, start by detaching the Velcro strap at the top, then place the headset on your head. Once it's positioned, pull the 2 side straps forward to tighten or slide them backward to loosen. If you're using the upgraded Comfort head strap, follow the same steps but use the adjustment knob at the back. Twist the knob to the left to loosen or to the right to tighten until it's snug. With these adjustments, you'll be set for a secure and comfortable VR experience. Now that your headset's on, let's talk controls. To make selections in VR, use the trigger button on your controller. It acts like a click, allowing you to choose options and interact with your VR environment. For movement, the thumbstick is your go-to tool. Use it to navigate and move your avatar around within the VR space. And there you have it. Essential tips for a smooth, comfortable experience with your Oculus Quest 2. By adjusting your headset and learning the basic controls, you'll be ready to dive deeper into the virtual world.